Welcome, everyone. I really appreciate you taking the time out of your night to join me tonight, and thank you, Trish, and a big thank you to Chad. Before I get started, I just want to mention if you are not a member of Chad, I really want to encourage you to join because Chad is a nonprofit organization, and they were the ones really kind of advocating for ADHD and disseminating important information before anybody else was. I've been involved with Chad for a long time. I've spoken at the national conference quite a few times, as well as local Chad chapters. And it's an organization that's obviously very close to my heart. So if you're not a member, please do join. My methodology is research informed and based on evidence-based approaches. I'm not going to be citing much research in this presentation as it's designed for parents who want practical information, not research data. Most of my professional experience has been working with families of boys because I am one of the few males in a completely female-dominated field. So parents of sons tend to seek me out for that reason. And I do specialize in social skills for males. However, almost everything in this presentation is applicable to parents of girls. And if it's not, then I will specify that. And a quick disclosure that I do benefit financially from the ADHD Dude membership site and YouTube channel. And the picture you see on the right here is from what's called the Brochachos, which is my new animated video series for kids, explaining, teaching different concepts that I teach, and it's available at my YouTube channel. If you just click on playlist and then the Dude Talk playlist, you'll see the Brochachos video. There's 2 of them right now and more on the way. So I want to tell you a little bit about how I got into this work. So I entered the special education field straight out of graduate school as a school counselor. And when my son came along, and you can read about my story at my website, I have a pretty unique parenting journey that you don't hear a whole lot. But one of the things I noticed when I adopted my son as an older child when he was 8, and one of the things I noticed when he came to me was that he needed help with social skills. So I started looking around our area, and at that time we were living in the area where I'm from, which is Lower Merion, Pennsylvania, outside of Philadelphia. My nickname for it is the therapy capital of America because I think there are more therapists per square mile in Lower Merion than anywhere else in the country. So as I was looking around, there was plenty of social skills groups. And every time I would speak to somebody facilitating these groups, there was just something that didn't click with me. And I couldn't figure out what it was, but I just knew it wasn't what he needed. The other thing with all these social skills groups is they took a very, one size fits all approach where, we'll take a kid with autism who has limited verbal, ability with a kid with ADHD with this kid. And I thought to myself, well, how can you really teach social skills if everyone is kind of all over the map in terms of their cognitive ability and their learning needs? So I realized at that point, I have to take the learning into my own hands here because despite the amount of social skills groups in the area, that it wasn't going to work for him. And I was right about that. So that's how I got started on this journey that has taken me across the country for conferences many times, and I've been learning this for many years, and will hopefully continue to do that because it's what I'm most passionate about in the work that I do. So a little about me. I'm a licensed clinical social worker. I'm a school social worker, father to a son with ADHD and learning differences, as I just mentioned. I solely specialize in ADHD. I don't do anything else. Creator of the ADHD Dude YouTube channel and membership site, and I also have a Facebook page and all that social media stuff. And I run in-person programs here in Ventnor, New Jersey during the school year and the summer as well, and you'll see some pictures from that. And here's just a list of the different work that has influenced my methodology here. So I wanted to define social executive function skills because it's not a term that I ever heard anywhere. I kind of made it up, to be honest. So I defined social executive function skills as the executive function skills that are required to socially navigate through life successfully. In individuals with ADHD, the ones that I find to be most prevalent are, number one, first and foremost, perspective taking. So understanding others' thoughts and feelings and understanding how you're coming across to others. Situational awareness, which people often refer to as reading the room. I refer to it as reading the field. And the reason why is because a lot of times when kids with ADHD struggle with situational awareness, it's outdoors. So I'm sure some of you watching this right now have a child who has walked into the street without looking or has rode their bike across the street and didn't look both ways first. That, it might be impulsivity, but there's a good chance it's difficulty with situational awareness. I have a saying that for a lot of of elementary schoolers with ADHD, the hardest period of the day for them is recess. And the reason for that is because, again, they struggle with situational awareness or reading the field. Next one is relating to others' emotions and emotional experiences. So think of it this way, that if you tell me something sad, you expect me to respond a certain way to you. If I tell you something enthusiastically, I expect you to respond a certain way. If you don't respond to me in a way that I expect, I'm going to think that either you might be insensitive or lack empathy or don't care, and I just might think it's strange. So a lot of times, what I find with kids with ADHD is that obviously I find most of them have a tremendous amount of empathy, but they're not always relating to others' emotional experiences in a way that would be expected, and often that causes others to think that they lack empathy, which is not the case at all. Next one is initiation, so asking for help or clarification. Cognitive flexibility, that's a big one. Appropriate use of humor. Unfortunately, every single year I get a phone call or an email from a parent whose son has made some inappropriate joke in school, like, he's going to blow up the school or something like that, and winds up getting into significant trouble, often legal trouble, because he didn't know how to use humor, appropriately in the right context in the situation. So I want to explain what lagging social executive function skills are not. Well, people often use the term difficulty reading social cues, and I think that's just kind of a vague and abstract term, so I don't use it. So it's not difficulty reading social cues, it's those foundational executive function skills I just mentioned. It is not a lack of empathy. Autism misdiagnosed as ADHD. I can't tell you how many kids I've seen and how many parents reach out to me of kids who I've worked with and say, so, do you think John has autism? And I say, no, and here's why. And I don't really advertise this, but I have as much experience with autism as I do with ADHD. I just focus on ADHD now. And one of the things I can tell you is I find that a lot of mental health professionals have, well, first of all, social executive function challenges are really poorly understood in the mental health field. And people such as myself who go through graduate mental health programs really get no training in this. If you want to do this work, you really have to seek the training out on your own. So what happens is a lot of mental health professionals, they don't discern the difference between autism and ADHD, because when they see a kid with ADHD with social executive function challenges, they automatically presume the kid must have autism because they don't know that this is prevalent in kids with ADHD. Lagging social executive function skills are not a lack of positive peer role models. I always say you do not pick up social skills by osmosis. A lot of times parents think, well, if he's just around kids with more developed social skills, then he'll improve. And that's just not how it works. They're certainly not the result of poor parenting. And the last thing I want to say is that lagging social executive function skills are not a mental health issue. It's a learning issue, and we can teach this to kids. So the social executive function and language connection. One of the things I think in the ADHD field, we don't talk about this enough. And I will mention to you, a lot of the training that I've done comes from actually the speech language pathology field, not from the mental health field. And I will tell you that the speech language pathology field is really what has influenced my approach the most, more than anything. So much of executive functioning is based in language because what's called verbal working memory is self-directed talk, stated intentions. I refer to it as brain coach with kids. So if you're not hearing your self-directed talk, you're most likely going to have social executive function challenges. When I do groups for kids, and I actually did this past Sunday because I have my guys group going on right now, my middle school guys group, I said to the kids, raise your hand if you hear yourself talking to yourself, and probably less than half did. So this is something that's a little bit of an abstract concept because it's hard to quantify, but think about this. If I say something offensive to you, it's because I'm not thinking about how I'm coming across to others because I'm not having that internal dialogue in my head beforehand. Okay, and that's often what happens with people with ADHD. So you cannot improve socially if you do not address the underlying social executive function issues, which are based in language, specifically self-directed talk. So let's talk about what lagging social executive function skills look like in elementary school. Well, propensity to be bossy or controlling in play situations often relates better to younger kids or adults, sometimes even much older kids than similar age peers. A propensity to talk at others about their interests, so having one-sided conversations where they're just talking at others about Minecraft and so on. difficulty in unstructured social situations like recess, but can present okay in structured or even semi-structured social situations, can make friends easily, but has difficulty keeping them, may claim they are being bullied when their words or behaviors elicit a negative response in others. Whenever I bring this one up, people give me some pushback about it because they say, well, you're victim blaming. And what the research data shows is that often bullying is a result of some type of action or words that elicited a negative response. So if you have difficulty with perspective taking and you are being bossy and controlling of other kids on the playground and yelling at them because they're not playing your way, and then they say, I don't want to play with you anymore, and then you say, well, they're bullying me. Well, is that bullying you because they don't want to play with you anymore because you're being bossy and controlling? So that's an example of that. Often they may be smothering of a new friend. I can tell you, certainly boys do that, but I think that girls have more of a propensity to do that in my observation. Second grade, so around age 8, is when social executive function challenges become noticeable. And fifth grade, so between ages 10 and 11, is when most parents fully realize that their child needs help with this because social expectations increase at the beginning of adolescence, and so on. So in middle school and high school, lagging executive function skills, social executive function skills, can look like often the same ones I mentioned in the previous slide, particularly the talking at others. Has often kids begin retreating into an online world of video games and social media. Often I see inflexibility gets worse around age 14 to 15, which I labeled the inflexibility tipping point, because I've never seen this described in any of the ADHD literature, but I've had so many parents say to me, yes, that's exactly what happened. Between 8th grade and 9th grade, my child became much more inflexible and it just kind of got worse from there. They often criticize other kids, particularly other kids with ADHD. So they'll say other kids are weird or annoying, and they might be critical of things that other kids have actually criticized them about. Inappropriate use of humor. May only want to befriend kids with higher social status who are not accepting of him or her. I call that it's the cool kids or nobody. That's a type of inflexibility. Lack of understanding that kids his or her age spend time with peers outside of school. I hear a lot of parents say to me, their kids say, kids don't hang out anymore. We only interact through Xbox or the phone, whatever. And that's not true. Kids still hang out. And the last thing I want to mention is a lot of parents say, well, my son says that he doesn't care what people think about him. And my response to that is, of course he cares what people think about him. He's saying that as a defense mechanism. And really what that means is that this is really hard for me, or I've been hurt too many times. So I'm just going to kind of put on, this shield to kind of protect myself because this is something that I struggle with and it's difficult for me. And often there's a lot of shame around this too, because for a lot of kids with ADHD, they realize that this comes easy to other kids and they don't understand why it doesn't come easy to them. So that's one of the things that's really important to me, is that we normalize this for kids and explain to them, there is nothing wrong with you at all. Everybody's brain has certain things that make them easier to learn or harder to learn. So I say, for myself, my brain makes sports harder to learn. I'm not coordinated. It makes math harder to learn, but it makes the social stuff easier to learn for me. But that's just me. Everybody has different things that are they have to spend some more effort learning or practicing. And if social is one of them for you, there's nothing wrong with that at all. So parents often ask, will he or she grow out of this? So my response to that is, have you ever met an adult with ADHD who might struggle with saying offensive or hurtful things, yet seems oblivious, struggles with understanding how they're coming across to others, a propensity to be argumentative, black or white thinking, where they see things one extreme or the other. They might use an abrasive tone with others. They might miss the bigger picture, take things out of context. So what I want to tell you is on a weekly basis, I have to delete comments on my social media from adults with ADHD. Sometimes they are long diatribes where they're telling, parents who leave comments on my posts, that don't listen to this guy, he's stupid, only listen to me because I have ADHD. Other times it's, exhibiting this really extreme black or white thinking. It's taking things out of context. So are there some individuals with ADHD who improve socially with age? Absolutely. But we don't know why it is that some do and some don't. And this is one of the comments on my Facebook page that, is representative of the type that I have to delete on a weekly basis. This one's a little extreme, which is why I used it, but I just wanted to, show you that this does not always just go away with age. In many cases, it doesn't. The one other thing, I'm sorry, I just want to mention about this, I tell people in our culture, people will tolerate men with some social quirks or men who make social faux pas. Our society is much less tolerant of women who make social faux pas. The difference between social executive function challenges and social anxiety, I will tell you, professionals and parents often mistake social anxiety for social executive function challenges. I used to constantly get calls from therapists saying, I have a kid with social anxiety, he needs a social skills group, and I have to explain to them, no, he doesn't, because this is social anxiety. It's not the same thing, and the research shows that social skills groups are not effective for kids with ADHD. So social anxiety is a fear of others' judgment about you. In kids with ADHD, this is often specific to similar age peers. And I don't think this surprises anyone because, approximately 30% of individuals with ADHD also present with anxiety. Social executive function challenges are skills that have not developed intuitively from a young age to the same extent of your same age peers. And one of the things I always ask parents is, please do not presume that your child has social anxiety just because you're reading this. I don't know why, but I find that parents often rush to assume that their child has social anxiety when I explain this. So let's talk about what does not help build social executive function skills. Well, again, they are a learning issue, not a mental health issue. But when parents create scaffolding and change the way they use language, they can help build social executive function skills. Here are the things that don't help. Being around kids with more developed social executive function skills. Role-playing scripted, socially appropriate behaviors. Let me explain to you why role-playing doesn't work. All social interactions we have are context dependent. They change based on what's happening at that moment in time, who is there, right? And we adjust our communication based on who we're with, obviously. So in terms of role playing, well, if you're going to role play, then you would have to role play every single variation of that social situation. So that's why I don't do role playing. I don't think it's effective. And again, all social situations are context dependent and they vary. Traditional talk therapy counseling does not help build social executive function skills. I find a lot of parents, that's the first thing they try, expecting some results from it, and it's not, it doesn't work. And as I mentioned, most social skills groups. So I wanted to just read this piece of research data. Although social skills training is a common intervention approach, evidence to date suggests that social skills training has limited efficacy, at least when provided in traditional clinic-based settings. I took this ad here for a social skills group, and I just want to read it to you real quick. It says, this 10-week group therapy program will help boys develop social skills. Topics include friendship, communication, conflict resolution, taking responsibility, recognizing and expressing feelings, self-esteem, decision-making, and responsibility. Boys enrolled in this group will master these topics when interacting with their peers. Well, if this actually worked and you can do that in 10 weeks, then sign me up, because I would be really rich right now if that was the case. That is just completely unrealistic. So I have a saying that I want to share with you, which is most parents are unintentionally misled as soon as their child receives an ADHD diagnosis. And here's the reason why. Most professionals, including medical professionals, they're not familiar with the American Academy of Pediatrics treatment recommendations for children with ADHD, which are, just so everyone knows, and you can look this up, for under age 6, it's parent behavior training first, followed by medication management. For age 6 and up, it's parent behavior training in conjunction with medication management. So I wanted to read this quote from Dr. Stephen Hinshaw. Therapy might help for other conditions, but there is no consistent evidence these treatments are effective for the symptoms of ADHD. So kids with ADHD live in the present. I'm assuming probably a lot of you have heard that before. Okay, so this is where they live, where the yellow is here for those of you who are watching, and where they learn. On the left here, we have episodic memory. Episodic memory is the emotions associated with experiences. Kids with ADHD struggle with episodic memory in the sense that they do not always remember emotions associated with past experiences, unless, in my experience, it's a strong negative emotion. Now, this is not every kid with ADHD, but it's many kids, okay? So on the other end here, we have future thinking skills, or what's called nonverbal working memory. So future thinking skills is how we visualize doing something in the future. If you're trying to teach a kid, in a, individual therapy session, coping skills, let's say, all right, then you expect them to, in the future, use that a week later. Well, the time horizon, the time for which they can visualize things in the future, it's too extreme for that. So they're not able to do that. And that is why, part of the reason why individual therapy is not helpful, because we have to teach things in the moment for kids with ADHD, in the present, I should say. So, real quick about episodic memory and social executive function skills. Because kids with ADHD have difficulty with episodic memory, they may not remember positive experiences. So, here's an example. Let's say your child went to a summer camp last summer that they really enjoyed, and then you ask them in January if they want to go again, and their response is no, it was boring. Well, that's because they can't recall how they felt 7 months ago, and they're not remembering that they were successful at camp. They're not connecting the emotion to the experience. So many kids with ADHD will say no to anything new or unfamiliar. This could be because of their difficulty with episodic memory, or it could be because of their inflexibility, or it can be because of their discomfort in new situations. But what's really important is we do not allow kids to avoid new situations or new experiences, because the way you learn to navigate socially and the way you learn to get through initial discomfort is by putting yourself in situations. And this is based on the premise, with anxiety, if somebody has anxiety, the more you avoid what makes you anxious, the more it causes your anxiety to grow. So we don't want kids to avoid social situations if it makes them anxious. So here's some of what I teach kids in my school year and summer camp programs. So situational awareness, or reading the field, which is really called reading the room. I teach them their role in cultivating and sustaining friendships, because I find a lot of kids, they kind of expect the other kids to do the work. And that's not because they have a sense of entitlement or anything. They just don't have the experience and understanding that they have to really do some work here. Some kids with ADHD do, and they're great at it, but a lot of them don't understand the work involved, on their behalf. For younger kids, reciprocal play skills, so sharing an imagination and sportsmanship. I teach, because I do social, my guys group, specifically for boys, how male friendships evolve. I teach about using humor appropriately and what kind of humor, we do and don't use around others, and what is completely off limits. We always talk about getting through initial social anxiety in new situations. Showing interest in others. This is a really big one. In my experience, most kids with ADHD I meet are very socially motivated, but they're not always good in showing interest in others, because they're not having that internal dialogue with themselves. Their brain coach isn't reminding them to talk about things other kids like, or to ask other kids questions, to get to know them, or sometimes even, do what I call a fake out, where you fake that you're interested in what the other kid or kids are talking about, even if you're not really interested, because that's how you make yourself more endearing to others. And I always give an example that when I was in high school, I tell this story about how I faked an interest in hockey, because I had all my classes one year with a bunch of the guys from the hockey team. So I learned about hockey, so we would have something to talk about, and we actually developed, a nice friendship out of that. Structuring hanging out. I find a lot of kids don't want to invite other kids over because it feels too much pressure on them. They worry that, how am I going to entertain him? So often they need help structuring hanging out. And the other piece, the really big one, is different types of thoughts, so perspective taking. And I basically break thoughts up into three categories. And I use like a sports term for it called clutch, meaning clutch thoughts are when somebody feels comfortable around you, they like being around you. Neutral thoughts are when somebody is aware you're there, and they're aware that, you're aware that they're there, they are aware that you're there, but you're not really thinking about each other because you're just kind of doing what's expected in the situation and not calling attention to yourself. And I explain that most of life are thoughts about other people, and other people's thoughts about us are neutral thoughts. And cringy thoughts are when you say or do things that make other people uncomfortable, and vice versa. So this is a visual I use to teach how guys form friendships. And I wanted to show you this because you see at the bottom here, it says stranger and gaming acquaintance. A lot of kids with ADHD will say, I have friends, they're on Xbox, or whatever they play on, or Minecraft. But if you really start to dig a little bit, you find out that they don't know anything about these kids at all, except maybe, their gamer tag, their gamer name. I've had a lot of kids who have bought things for other kids online. They've bought them games, they've bought them Fortnite skins, whatever it is, because they want a friend and they think, okay, well, if I buy him this game, then, he'll play with me and I'll, have his attention. So that's why I put stranger at the same level as gaming acquaintance. So I want to give you some strategies to help, help improve social executive function skills. So share your internal dialogue out loud to help model your own internal dialogue around perspective taking. So think about this. If your son or daughter has difficulty with perspective taking, they're not having an internal dialogue thinking to themselves, about others' thoughts. So here's some ways you can model it, and you just say these things out loud. That was nice of that guy to pick up the lady's umbrella. She probably had clutch thoughts about a stranger doing something nice for her. I'm feeling a little bored right now because you're having a one-way conversation with me about Minecraft. I wonder if that girl realizes that other people are having cringy thoughts because of how loud she's talking on her phone. I noticed that when we were at Tyler's house, you did a good job doing a fake out when Tyler asked you if you wanted to play basketball, even though you really don't like basketball. So that's what it sounds like to share your own internal dialogue around perspective taking out loud. And what happens when you do that, you're modeling what perspective taking sounds like for your kids. Another thing is we can teach the cause and effect of the impact of your words and behaviors on others based on the context of the situation, because again, all social interactions are context dependent. So this is a tool that I developed. I call it the clutch neutral cringy figure outer. So you see step one, what is the bigger picture, which is the context of the situation. In the car with Josh and mom, my words and behaviors. I made a your mom joke to Josh in the car. Did my words and behaviors give them clutch, neutral, or cringy thoughts? Maybe cringy because Josh doesn't live with his mom. What did they do or say because of their thoughts? He didn't say anything and changed the subject. How I felt about it. Bad because I said that. Should I do anything differently next time? Don't make jokes about anyone's family. So really what I'm doing here is I'm teaching the sequence of events to help make visual perspective taking and help understand how your words or behaviors, others' thoughts about them and how they responded to you based on, how they felt, and then how you felt about that, and if you should do anything differently next time. And I base this on what's called the social behavior map, which is a tool from social thinking created by Michelle Garcia Winner. There is no right or wrong when it comes to others' thoughts. Rather, there's a range of thoughts others have based on the context of the situation or the bigger picture. So this is something I developed called the cringe to clutch-o-meter. So this is a tool that parents can use. So what's the bigger picture? And what we can show here is, that thoughts can range from what I call full cringe, kind of cringe, neutral, good clutch, and great clutch. And one of the things kids will often say, when they say something or do something that gives other kids cringy thoughts is they'll say to their parents, they'll argue with them and say, no, he did think it was funny, And here's what I teach kids. It's not about what you think. It's about what most kids would think or most people. Because remember, if you have difficulty with perspective taking, you think that everyone thinks the same as you. So you might have thought an offensive joke was funny, but nobody else thought that. But because you struggle with perspective taking, you would presume that they do. So this is how I teach to read the field or situational awareness, which you can do. And here I have a picture of the Walmart parking lot. So things we need to think about to read the field before we get out of the car at Walmart. When are we going to be there? Well, we're going to be there Saturday around 5, which is their busiest day, but not their busiest time. So there will be a good number of cars in the parking lot. What would reading the field in the parking lot look like? So notice I'm using visual language because I want them to develop a visual image in their head of what they should be doing in the parking lot. Looking to see if cars have their lights on because that means they might be pulling out. Don't walk too close to the cars because the person driving may not be paying attention. Anything else important to reading the field in the parking lot? You shouldn't be looking at your phone while you're walking in a busy parking lot. The reason I picked this specifically is because, I've been doing this work for a long time. And, during my camp program, I can't tell you how many kids don't use situational awareness in parking lots and they're completely oblivious. And what happens is a lot with kids with ADHD, their parents are always acting as their executive functioning. So their parents are reading the field for them. But what happens when you read the field for your kids, they never learn how to do it themselves. So that's why parents have to teach this. So before we finish up, I just want to share my social media with you. My YouTube channel, it's all free. You can subscribe. If you click on playlist here, you'll see the different playlists for parents and for kids. And I also have a Facebook group and Instagram as well. So some do's and don'ts. Do require your son or daughter to contribute to your home and teach them to think about the needs of others in your family. That's teaching perspective taking, but it's also teaching reciprocity in relationships. I see so many kids with ADHD, they have no responsibilities at home. Their parents have no expectations of them except for academic performance. That doesn't help you learn to think about others, and it's not teaching you reciprocity in relationships. So this is why I say make sure they contribute to your home and teach them to think about the needs of others. Next one, require them to participate in extracurricular activities, particularly at school, if they're that age where there's extracurricular activities at school. Tap into their episodic memory to help them recall past social successes and to remember what was enjoyable about being in social situations with peers. Use what I call purposeful recognition and praise to help them specifically understand what they did well in social situations. That is incredibly important because people with ADHD respond really well to purposeful recognition and praise that is specific. So saying things like, great job, you're so smart, that's what I call empty praise. We want to praise effort and resiliency and thinking about others because, again, we want to teach reciprocity in relationships. You should expect defensiveness if you try to help your son or daughter improve their social executive function skills without an education in this topic. And even with an education in this topic, a lot of teenagers are going to get defensive about this because it's a source of shame for them. Be extremely patient. The process of improving social executive function skills is very slow. When parents say to me, how long is this going to take? And let's say they have a 13-year-old, I say to them, I cannot teach your son or daughter in 13 weeks what they haven't learned intuitively in 13 years, okay? So you will see progress, but it's going to be slow. Expect inconsistency with social executive function skills because ADHD is a condition of inconsistent performance, which is another thing I think is not spoken enough about in the ADHD world, but keep that in mind. Okay, some don'ts. Do not use your child's sibling relationships or your parent-child relationship as an indicator of their social competency. Kids do not feel the need to use good social skills with immediate family because there's no social ramifications. So when parents say to me, I want him to use better social skills with his sister, I say that is not what social skills is about. You might want them to have a better relationship, which is fine, but that is not an indicator of their social skills. Big one, do not accommodate inflexibility because when you do, it causes inflexibility to grow. Don't allow them to avoid social situations or new experiences. Do not get pulled into the argument, negotiation, or reasoning vortex. This is something I teach in my parent behavior training program called Scaffolding Better Behavior and Self-Confidence. Don't expect much growth in the development of social executive function skills if you try to decide to treat ADHD your way instead of following the treatment recommendations. And I want to mention, I follow the American Academy of Pediatrics treatment recommendations, not just because they're from the AAP, but because I really do find that they produce the best results for families in the most cost-effective way possible in the shortest amount of time. So that's why I feel strongly about that. Really important one. Do not prioritize protecting their feelings over teaching social appropriateness because they will learn social appropriateness from peers who will not be concerned about protecting their feelings. So I have a saying here, you can protect your children from experiencing temporary discomfort or you can prepare them to navigate socially in the world, but you can't do both. The social world is often uncomfortable, so if you protect them at the expense of developing social competency and resiliency, then all they will have left is the hope that you will always be there to protect them from experiencing discomfort. I wanted to end with this because this is from this past Sunday from my most recent guys group. I said to the boys, they're all in middle school, I said, what do you want to learn while you're here? We talked about, the different things we cover in the group. So I'm going to read some of these to you for those of you who are not watching. And these are just 3 out of the, 8 or 9 kids I had. So how to know if somebody wants to be your friend, how to keep friends or stay in touch with them, go from in school to outside of school, he means friends, how to get people to want to hang out with you instead of you always asking them and them not answering, and how to make good friends. And I really want fathers to see this because a lot of times, I find that mothers are concerned about their kids' social skills and fathers will say, particularly with sons, he's fine, leave him alone. But this is the kind of thing, right, that shows you this is really what's on kids' minds. They might not articulate it to you They might not have the language to always verbalize it, and they might not want to say it, particularly to their parents, but obviously that this is something they want help with.
What are your thoughts on the children who use technology, using online chatting and social media basically to practice their social skills rather than doing it in person?
Yeah. Well, what I teach kids is that, so much of our social communication gets lost through electronic communication. So I don't have any problem with it. But at the end of the day, you can't go through life just interacting with people through screens, right? We have to be able to interact with people in person, and we get so much more from in-person social interactions just in terms of kind of, we get a feel for somebody, which you don't really get online or through Zoom or whatever. So I think it's fine, but it can't be that that's all there is.
How do you handle other adults and children who don't understand the impact of ADHD and judge the behavior of your child?
Yeah, so that's a really hard one. And, one of the things I have, I'll tell you another saying I have is that when a child has autism, they have a disability, but when they have ADHD, they have a character flaw. And what I mean by that, that's not my opinion. That's how our society perceives things, you know. And I think what I want to share with parents is that you're going to have to learn how to let things roll off and not get into defensive mode, because at the end of the day, I don't think ADHD is taken very seriously in our society. And as a result, that's why people see it as a character flaw. So don't feel the need to defend yourself. Don't feel the need to defend your child. If somebody is criticizing your parenting, know that it's not really about you.
What question, and I think you talked about this earlier, so maybe just clarify a little bit. This person's question is, what questions should a parent ask in order to evaluate its social skills group? But you mentioned, I think, that social skills groups don't work. So could you clarify that?
Yeah. So what the research data shows is that social skills group are not effective, at least when presented in a therapy office clinic type setting. Okay. So there's a difference between kind of your general social skills groups and what a speech language pathologist might do, which is called social pragmatics, which is often designed for kids with autism who have some language difficulties. Here's what I'm going to tell you. Rather than trying to find a social skills group, and what you should do is think about extracurricular activities. I tell parents I have seen scouts, Boy Scouts, Girl Scouts, youth groups at churches or synagogues do more for kids socially than any social skills group. Okay. And the other thing I want to mention, and I hate to, kind of say this, but most people who run social skills groups have actually no training in it whatsoever. People run groups because they're profitable. All right. And I'm not saying they don't mean well and their intentions aren't good, but most people who run social skills groups have never done any kind of training in this topic.
This is more of, I guess, guidance or advice rather than a question. My son has a lot of anxiety around social functions when it's a new activity or event, and is reluctant to do new things. And they don't want to be pushy, but they also want to be encouraging. Do you have any advice for this parent?
Yeah. So a few things. Number one, you can do previewing with him beforehand where we talk about kind of what to expect. If there's visuals you can show him of the space you're going, we want to basically, help him read the field beforehand. So kind of help him get a sense of, the noise level, the space, how many people are going to be there, what's the mood, and so on. Here's a really important part, though. You don't want to allow him to avoid situations. And when you say, I don't want to be pushy, what I'm going to tell you is, yes, you do want to be pushy. Because if you allow him to avoid social situations that cause anxiety, then you're accommodating anxiety. And when you accommodate anxiety, it causes anxiety to grow and get worse. Okay? So there are things that can help with this. I will tell you that cognitive behavior therapy is the kind of go-to treatment for social anxiety. But here's the but. Cognitive behavior therapy has not shown to be real effective with kids with ADHD. It's shown efficacy for older teenagers and adults with ADHD, but not kids. So what I would say is if you can find somebody to work on what's called the exposures part of CBT and really focus on that, I would suggest that. But other than that, what you have to do is, again, you don't want to accommodate his anxiety. You want to be pushy because this is how he's going to learn to get through it.
Do you have any tips on how to teach your child to let negative social comments roll off their back, especially when they're extra sensitive to those comments?
Yeah. So, well, let me say it this way that I get negative social comments almost every day on my social media, and I don't let it roll off my back. It bothers me. So, I think the best thing we can do is just help kids to understand that this is normal, okay? And what we want to say is, you want to not you want to help your brain get unstuck from this, because a lot of times if somebody's saying something negative to you, they're doing that because they want to show off or because they feel bad about themselves. And sometimes maybe they're pointing out a behavior that maybe we need to think about, that we're doing or saying something that's giving them cringy thoughts. But sometimes they're just kind of being mean to make themselves feel better, you know, and know that it's okay that if you get upset about somebody says something that's, mean to you, because adults feel that way too.
This parent is asking, they have talked to their 10-year-old impulsive, reactive son regarding inappropriate jokes, and he seems to, it just keeps reoccurring, and he just doesn't seem to get it. So they're just wondering what can they do differently in their approach to make it click so that he
Yeah.
understands it.
So what you want to do is you have to teach him, like I showed the clutch neutral cringy figure outer. Just talking to him is not going to teach him perspective taking, right? We have to make this visual because this generation of kids learns visually. So we want him to be able to understand, right, how his words, his humor, what kind of thoughts it gives others, how they might respond to his words or his humor. And then how is he going to feel about himself if he knows others are having cringy thoughts about him because his humor was offensive? Okay. So we have to teach this to him, that it's not it's about the sequence of events that happens here and others' thoughts and how they're going to respond to you. A lot of times what I find when parents try to teach the social stuff, it just sounds like lecturing to kids. So we want to take the thing away from saying, I told you not to do that and you still do that, or every time you do this, right? We want to take it away from that and focus on others and others' perception. And that's how you teach perspective taking. And we want to use visuals to do that, like the one I use, and also change the way you use language as well.
Can you explain the difference between SEF and executive function skills, such as organizing their work?
Yeah. So, well, social executive function skills are just basically an aspect of executive functioning, right? So think about this. So, a lot of times, let me just say this. A lot of times people think that executive function skills means academic organizational skills, but it's so much more comprehensive than that. It's so much broader than that. And I think a lot of times people think that because a lot of ADHD coaches, that's what they focus on, is academic organizational skills. But, cognitive flexibility is part of executive functioning. And all these other things I mentioned as well. So think of this: social executive functioning is just the aspects of executive function skills that we use when we're interacting with others.
What sort of scaffolding would be good for helping my son make school friends into outside of school friends?
Yeah, that's a great question. That's one of the things that I focus on. Is number one, we want to teach them how to make plans, because a lot of times kids with ADHD will say at 8:30 on a Saturday night, can Joe come over? Well, no, it's a little late now. So we want to teach kids, how to ask somebody over. And what I teach parents, this is really important. I should have included this. That stop making, if you have a child who's in fifth grade or above, it is no longer age appropriate for you to set up play dates for them. Okay. But here's the other thing: you always want your child to invite another child over, rather than you doing it, because when your child does it, it makes the other kid feel good because they're showing interest in them. So regardless of their age, you want them to initiate that, and then you can talk to the parents about the logistics, okay? So that being said, we want to teach that. We can help kind of scaffold what to do during a get together. So we'll say, for a half an hour, you guys can do this, and we don't want to direct it, because what I always tell parents is stay out of it, because so many parents of kids with ADHD, they're constantly hovering over the kids. When the kids have play dates, they're monitoring them, they're watching the whole time, and that makes other kids feel uncomfortable and might make other kids not want to come over again if they feel like you're monitoring them constantly. Okay, so you want to teach, how to make plans, when to invite somebody over, how to structure that time hanging out, how to help the other kid feel comfortable. So like when they come over, you show them where the bathroom is, you ask them if they want something to eat or drink, those kind of things. So it's really just kind of structuring that for them and helping them with that.
Do you have any advice specifically for parents who are helping their children make the adjustment from elementary school into the middle school years, which we know is very challenging.
Yeah, well, that's a presentation in itself. One of the things I tell people is the second half of fifth grade is when I see things really start to go south socially for a lot of kids. And the reason for that is, again, social expectations go up. Kids are, often, it's the beginning of adolescence. It's when, boys want to hang out with boys more and be part of a male peer group. Girls want to be part of a female peer group. So, and other kids become even more noticeable, or kids are more aware of, your social executive function challenges. So in terms of what you can do to help, well, I think it's really the things we're talking about here. There is nothing that I do, specific for fifth grade, I would say, except teaching the skills and the scaffolding that I've been talking about this whole time. And know that part of this has to just do with maturity as well.
This person is asking if you could elaborate on the reciprocity of friendship and what do ADHD kids need to do that they aren't doing?
Yeah. So often what I see is, as I mentioned, most kids with ADHD are very socially motivated, to varying degrees, and they want to have friends. They like being around other kids, but they don't always understand their role in, cultivating friendships and sustaining friendships. So we want to teach them, about you have to reach out to other kids when you're not with them. So that's fine if it's doing it over Xbox or Minecraft or whatever, or you're texting. But you have to show other kids that you're thinking about them. You have to show interest in other kids by talking about things that they like, even if you don't like it, because other people do that for you. When I say what I just said before, when I say this a lot, I often get a lot of pushback because the term masking is being used a lot in the ADHD world right now, and it's not even being used correctly. And parents are saying, well, if you're teaching him to fake interest in others, isn't that masking? And what I say is, well, if you don't want your child to mask, then teach them that they should walk out of class whenever they're bored. Teach them when somebody else is talking to them and they're bored, they should just walk away from them. And you're basically teaching them to be profoundly self-absorbed, okay? So that's part of reciprocity in relationships, is showing interest in others and listening to others even when we're not really listening. I mean, how many of you who are married or have had significant relationships have done that, right? That's part of life, all right? But here's the other part about that I want to mention as well. Because I see so many kids with ADHD who have no expectations at home, they don't have chores, they're not really, their parents don't ask them to think about other, their family members. They have a propensity to kind of become self-absorbed, even though that's not really who they are. They've just never been taught to think about others. So that's why I'm saying make them contribute to the home. One of the things that I teach in my my parent behavior training program is when kids do something hurtful to somebody else in the family, you do what's called a cleanup. You make amends to them. So, if you yelled at your sister or you hit your sister, well, you do her chore for her that night, or you do something besides just apologizing. The whole premise of actions speak louder than words. That is all teaching reciprocity in relationships.
This parent said that she really it resonates with the information that you've been sharing with the on the slides, and she's feeling a little overwhelmed. She just doesn't know where to start as far as teaching the skills. So do you have a step one? Where do you start?
Yes, and this will cost you no money at all. Go to my YouTube channel, ADHD Dude. I have a Start Here playlist for parents, and I also have a social skills playlist here for parents, which are, the most viewed videos. So I would start with the Start Here playlist, and then you can watch, the social skills playlist as well. Because this is overwhelming. I want to acknowledge that.
How are your guys groups different from a social skills group? So what's the difference?
Yeah. Well, number one, I'm not teaching kind of scripted, communication. We're not sitting around and role playing. We're not, playing role games. We're not playing board games where I'm prompting kids what to say or to compliment each other, those kind of things. What I'm doing is I'm teaching these concepts. And then the idea is that I hang back as much as possible, myself and the other guy who works with me. And while the kids are playing games or they're walking, whatever, that's their own thing. And I only intervene with kids if I need to. So if I see somebody walking alone and I know they're feeling kind of uncomfortable or kind of anxious, I help them understand how to insert themselves into one of the conversations going on. I want everyone to understand, too, that I have, invested a tremendous amount of time and money in learning this stuff. So, really, I got started with the social thinking material back, I don't even remember how many years ago, 11 years ago now. And that really kind of forms the basis of everything for me. And then I kind of took this more boy specific approach, because the reality is most of the people who run social skills groups are women, running social skills groups for boys or co-ed groups or whatever. And I felt that there was a need for a male specific approach, and I didn't know how that would resonate with people. And I was shocked at the response I got, particularly from mothers, how happy they were I was doing that. So that's what I do is, I teach and then I hang back and let this be experiential for the kids, and, just insert myself as needed.
You say that kids should initiate play date invites by middle school, but what should parents do if they don't want to and just want to play video games instead?
Well, don't accept that. Okay. So the number one, and what I would, so there's a few things. One, we have to find out, is this because of their social anxiety? For boys, I find a lot of times they don't want to invite somebody over because they're scared of the rejection. And they feel, and I've had boys articulate this to me, they say, if he says no, then I'm going to feel really weird around him. And I said, well, what if he says no because he has to do something with his family? So that's the first thing, is we have to help kind of with that process of, are they avoiding this because they're scared of the reaction? Are they avoiding it because they don't know how to structure the get together? Because I do find that's a lot of pressure on kids. Or are they just avoiding it because video games is easier? So here's the thing. You can't force them to invite somebody over, but you can limit video game time, and you can require kids to participate in activities. So that's why I say things like youth groups and like scouts, I find are really important for kids, and why I feel really strongly about getting kids involved in extracurricular activities as well.
What advice do you have for parents who actually they themselves are struggling with those social skills, and so they're not sure how to explain all of those steps well to their kids?
Yeah. Well, a few things. Again, I refer you to my YouTube channel where everything's free and you can watch videos on this to help you learn these concepts. And the other thing I would say as well is, for those of you who are parents who feel that you struggle socially, Caroline McGuire is excellent at this, and she has an online group going on for adults right now, I believe. So I would look at Coach Caroline. I think is her website.